That was School Board Spotlight. We are now Superintendent's Report. And Dr. Ross, your own.
Thank you, Madam Chair, members of the school board, to our community and our guests and administration. We again thank our faculty and staff for their hard work. I know when we speed the clocks up an hour, it's tough to make that adjustment, but everyone came in this morning, did some great PD, so we thank their hard work for that. I'll begin each one of our presentations with a reminder that we are a system answering 3 critical questions of our vision question, why we do this work, our mission question, how and what are our outcomes, reminding us of our vision that was created by our faculty and staff. This comes from District 5. And the group that we just recognized, those social workers, do an amazing job of showing that love to help provide the emotional growth. We talk about our mission statement that helps guide us on our how, and we wanted to focus on different parts of it today, mainly providing a safe and secure learning environment. And for that, I'm going to turn over the part of this presentation to our Chief of Student Services and Planning, Dr. Mike Harris, to talk about what we are seeing in terms of our COVID mitigations, as well as our what we're doing honoring mental health, just with our social workers. So, Dr. Harris.
Good evening to all of you. We're certainly very happy and very fortunate to have an opportunity to talk about our COVID relief plans, activities to date, and how we plan to move forward. Typically, we would have Director Van Holden, who would come and share with you by way of updates in the general community, reference to the charts that we have maintained over the course of the year as it relates to our dashboard. In that, the HEC has made its to our count, its 12th change to the COVID plans. We've asked Nurse Stanek, our Nursing and Health Services Supervisor, to come forward and to share with you what I think you have a copy of, our mitigation plans, level of mitigations. Those are actions that we take place here in School District 5, and it helps the schools and our district offices in terms of how they would govern themselves now that we have moving forward and hopefully away from and out of the COVID pandemic. So, well, with nothing, without anything further ado, we're going to ask Nurse Stanek to come forward and to give us a highlight of the levels of mitigation.
Good evening. So our mitigation strategies are based on the DHEC COVID guidance. And the first version of this came out in July of 21. And like Dr. Harris said, we're now on the 12th revision of this guidance. So our latest mitigation changes are more closely reflect the latest version of that guidance. The biggest changes involve masks, volunteers and visitors, and field trips. And the changes are felt the most when we're on level 2, or the green mitigation level, and that is currently where we are. When it comes to masks, DHEC states that they're most beneficial when county transmission levels are moderate to high, and therefore encouraging mask wearing on level 2, or the green level, was removed from our mitigation. However, it's important to know that anyone in the school setting is allowed to wear a mask at any time, and they should be allowed to do so without risk of criticism. So visitors and volunteers are allowed in our buildings when we are on level 2 or level green. We just ask that they self-assess before they enter the buildings. When we are on level 3 or level 4, we allow visitors for specific medical or educational purposes. When it comes to field trips are allowed without restriction on level 2, or our current level. We just highly encourage the sponsors of the field trip to check on any applicable COVID precautions or policies at the destination that they're going to. When we get to level 3, field trips are still allowed, but they're a little more restricted. Those would involve competitions and internships, and any kind of class assignment would be given priority at that level. And just a quick reminder, quarantine and test to stay is currently suspended. In the very unlikely chance that we would have to institute that again, it would only happen at level 3 or level 4. So we did leave that verbiage in the mitigation on those 2 levels. And that's a very quick overview of the changes to the mitigation. Thank you.
Thank you. Is there any question on that from board members? Ms. Huddle.
We had an email, I don't know if all board members got it, but recently from a parent that there was an elementary school that I think had an event that normally parents would have been invited and they were not, I think. Is that just because we were in transition, or now that we're in green, would an event that normally parents would be invited to, would they be able to come going forward?
I'm going to let Ms. Miller speak to that.
Yes, ma'am. And we did follow up on that, and you're exactly right. It's because we were at the very end of the former mitigation before the update was released to principals, and there wasn't enough time to get that notification out. But yes, ma'am. And our principals are working. I will say that we do want to keep in mind our principals are working to help to have ways for parents to come in to the buildings and do that. But we also want to keep in mind, I know our clinical counselors are coming up next, that other adults haven't been in the buildings for a while, and so we don't want to have a mad rush, with all the kids. So we certainly want parents in the building. We certainly want the community, to be in there, but we have to be mindful of that transitioning going into that. So I know our principals are working very hard to have like maybe lunch days for this grade, to come in and things like that, because we are still mindful of our spacing as well. So great question.
Were you finished?
I had one other, but
Mr. Lovelace, and I'll come back to you. Mr. Lovelace.
Dr. Ross, and I guess this will go to Nurse Stanek maybe, but we approved additional contract workers a while back to do contact tracing. And now that there's hopefully a lull forever, but right now there's a lull in the COVID situation. Can you tell us what those, are those contract workers still with us and doing other tasks, or?
So we have 2 groups that we helped to do contact tracing. The first we call the surge protectors. This is when we did the special modification to the contract for ESS to allow the perm subs at each school to serve in that. Those employees are returning into the rotation in the classroom. Dr. Harris or Nurse Stanek, can you speak to the agreement that we had with the contact tracers?
Right, so we have currently 7 staff members through the CDCF Foundation that are helping us. And they are very valuable right now because nursing services now is trying to catch up on things that had to kind of be put aside for contact tracing. So, for example, immunization non-compliance, we have a good many TDAPs at the 7th grade level that we need to follow up on, and they're helping us with that. We have not been able to do vision and hearing screenings in 2 years now, which really hurts my school nurse heart. And so they are helping us organize and find the students that most need that screening, and they're going to help us with that. And that's just 2 ideas. I'm sure more will come up. So they're still helping us. We still need their help.
Good question, Mr. Lovelace. And you had another one, Ms. Huddle?
Yes, ma'am. The green says low community transmission and low positive rate on the District 5. So I just was kind of curious, is that an and or an and and an or, for example, just to throw an example out there, because we've had this happen where the community transmission is moderate or high, even though we had very low transmission in the schools. So for example, if we kept low like we are now within the district, but the community level would move to moderate, would we be allowed to stay in the green, or would we have to move to yellow?
That might be a Van Holden
A follow-up question?
Yes.
Okay.
Van, he's not here.
Well, we know that he's not here with us tonight. What we do know is we have to continue to monitor, because there's another thing that kicks in when we get over 10% locally at any school, and that is the notion of contact tracing. So as we look at this, we try to go local first, and then every Thursday, that's when we get that indication that the county levels have changed. And so because it affects every school, for instance, we've had in our previous, we would be orange as a district, but you could find certain schools that were way below the cap, and it was still orange. So county data really affects us on this. So I really believe it's that if you go higher, it's going to take you out of that level. Or if the county goes higher, that can take you out the level. Is that how you see it, Dr. Harris? Or?
I'm going to concur with you, Dr. Ross, absolutely. For you as board members and the community, we will not and have not deterred from continuing to monitor what's happening throughout the community and what the data has to say to us. That still continues. In fact, you will still see that there's still portions of that dashboard still available to you. So that work will continue. However, when it does hit a point where it causes concern, that'll be a conversation we'll have to have, and it may, in fact, adjust the color code that we currently know. It may do that. But so I would agree. I think it is an and not a either-or scenario.
Okay. Any questions, Ms. Hines?
My question is regarding the level 1 blue level. I know that it says implementation when DHEC no longer provides school guidance and/or reports COVID data. I believe that DHEC is about to transition away from the daily reporting to like a weekly reporting. How does that play into how we get to blue? Or does it?
What that simply says, and you're absolutely right, there is a conversation, I'll use that term, about moving further away from what they're currently providing. What we saw here in terms of governing schools, that again, as I said, once DHEC no longer reports and basically gets out of the business of reporting and sharing information related to COVID, then that's going to assist us in making a determination as to whether or not we're in blue or not. Until such time, I think we would have to continue to utilize the levels as we currently know it, and for at least the next little while, we'll keep our fingers crossed that we, at least to a minimum, will maintain the green status.
Can I have a follow-up? So that, I just want some clarification. So that means that if DHEC decides to report weekly numbers indefinitely, we will indefinitely not go to blue?
Again, that is the conversation that we would have to have internally as to whether or not we continue to make any more adjustments or refinements to this mitigation. Because keep in mind, this is based on what we do here in School District 5. So I think it's just another factor that we're going to have to consider, Ms. Blackburn-Hines, before we make the determination to change and adjust what we currently have. So I don't want to give you that yes, absolutely, or no, positively not. I think it's based on the data and the information we have to make the best and most informed decision.
Mr. Hogan.
Dr. Ross, you might help me with this one or someone else. And looking at our dashboard now, and first of all, compliments to it. It's, in my opinion, the best of any school in the state. But how long do we anticipate tracking this data?
That's a good question. We're looking at the trend, and I commend Dr. Harris not getting too far ahead of DHEC, because we've used them as our health board guidance to them. But listening to Dr. Traxler, you can see from where we were on version 12 to where we are, that they're going to be more endemic of COVID-19, meaning that we will end up treating it like the flu. Now, no one's going to write that down or go on record of when that's going to happen, but that's when the blue will take place. Our comfort is we've seen us kind of stair step down away from the protocols we had in Alpha, We just don't know when. So what we have changed in this version 2 is forgive the terminology, the bluish kind of green we could provide here until they have cut it off and we're no longer responsible for tracking. Once we turn our dashboard off, then we're at blue. But this allows us to get parents in, and to Ms. Miller's point, we would ask that for these first 2 weeks, as parents could help us with volunteering, because we're not at the place that we typically are in a school year. You heard Nurse Stanek say that when you come into a health room, that nurse is dealing with the aftermath. So they're not in a green mindset. A lot of our staff are still in orange mindset. And so we would need and ask that parents come in as volunteers for these first few weeks, or maybe first 3 weeks, to help bring the staff to a green mindset. So while the numbers may change, the way we operate, the way people feel, the workload that's been piled up, they're still at orange and some of them at red. So we would ask that if people could come in this week, maybe forgo the lunch with your child to volunteer and help a teacher cover a lunch while your child is there eating. So a short answer a long answer to a short question is, we believe this will be more endemic, and we will go to blue at that point. But as long as they're recommending a tracking system, we'll be at this very phased down level of green.
That good, Mr. Hogan. Okay. Ms. Gardner, any questions? Be sure everybody got called on. Thank you so much.
I want to thank and Dr. Harris and his team at Nurse Stanek is standing there representing all of our school nurses and all the what's going on in the health room. A lot of people have gone through a lot, but I think that first line of defense has been our school nurses, and I know that's one of the groups that as we go to green, they're still at orange and red, and so anything that we can do to encourage them, we take the opportunity. So speaking of that mental health support, we are dealing with an aftermath of going through a pandemic. And Dr. Harris has worked hard to bring us additional supports through ESSER, through clinical counselors. So I asked Madam Chair, members of the board and the community, for Dr. Harris to come forward and talk to us about these additional supports that he has brought through with the clinical counselors.
Good. Thank you again, Dr. Ross. And I'll say a special thank you to you for acknowledging, as you have consistently done, the work of our school nurses. And I, too, would want to go on record for acknowledging not only their work, but certainly the leadership of Nurse Stanek. And she has represented this school district so very, very well. And I cannot say enough about the work that she and her entire team of school nurses have done. They are extraordinary. And I commend them all for what they have done and continue to do on a very consistent basis. Having said that, there is yet another team that I'm happy to be a part of that is also extraordinary, and I have two of them here tonight who will give us, to you board and to our general community, just some insight into the operations and the identification and clarification as it relates to clinical counselors. It is because of the support of this board that we, through our ESSER funding and the support of our colleagues here who have chimed in various and sundry ways, that we have brought together, and we now have 9 clinical counselors, 3 in all 3 of our geographical areas. And we also have the lead clinical counselor who is here, who is also new to our school district, and she will have opportunity to speak as well. She'll be joined by Ms. Jennifer Felker, whom I'm sure all of you are know and familiar with, who is our coordinator of parenting and social work services. They both will come at this time to just kind of give us some insight information as it relates to clinical counselors and the role in which the clinical counselors will make and take as we move forward at this particular year. So thank you, Ms. Beth Hook and Ms. Jennifer Felker.
Thank you so much for allowing us to be here together today, and just to present something that we've had as a vision and as a need for mental health supports in School District 5. Just to get started, we've actually had a lot of support in District 5. I don't know where the little clicker is. Is there a clicker? All right, here we go. So just kind of wanted to just say what a wealth of information that we've had and the support we've had in District 5, that we already had existing in School District 5 school counselors, school psychs, and school social workers. And again, we are very blessed in School District 5 to have these resources, but we also saw the need for additional mental health supports. Again, we have our school resource officer, our behavioral interventionist, and our expectation coaches in District 5 currently that kind of serve mental health services. And if you see in this graph right now, we've got school counselors, school social workers, school psychs, and our D5 clinical counselors. And all of these services together make up our mental health wellness supports. And I'm going to turn it over to Beth and let her talk to you a little bit more about what that D5 clinical counselor is and what that will look like within our school district.
All right. Glad to be here tonight. So I am Beth Hook, and I am coordinating the clinical counselor program for the district. And with that, like Dr. Harris had said, we have 9 clinical counselors that are located throughout the school district, and there are 3 per cluster. All of them have a master's degree specializing in counseling, and most instances all are licensed as professional counselors or social workers, and trained in counseling specifically. We are in all of the schools, as you will see as well. And the school assignments, that is data-driven, it is needs-based, so we may have some adjustments as we roll this out and determine where the needs are. They each have a base office in a school, so they are housed at that school, but they go to their other assigned schools as needed. The big part about the clinical counselor program and its addition is the ability to serve families and provide family therapy. And so their schedules will vary. They will be different than kind of the school hours because we'll have some late afternoon hours. We want to accommodate families and make sure we have that family therapy piece. And so we can concentrate on the entire unit with all the siblings, and we're going to coordinate that together as well. So our overarching roles, our biggest focus, again, is helping the students and families to navigate all the challenges that they have dealt with over all the years, including the pandemic, of course. We're going to collaborate, of course, with school staff. That is key. Communication is huge. Being a part of helping with those challenging behaviors between classrooms and in those transition moments for the kids that we're serving, and also consulting with teachers and staff to help increase their skills and knowledge base in helping with managing those behaviors. And of course, we will be upholding the ethics and confidentiality inconsistent with the licensure board that we are sworn to do. Again, the direct service, that is the key component. We're going to do everything we can to make sure that the clinical counselors are providing that direct service to families and to the students throughout the school day and after hours as well. Communication is key, so keeping the families involved in their child's treatment, being a part of that treatment is very important, and I think will increase our outcomes in a positive way. And then, of course, we can be a part of any crisis situation and de-escalation that is needed as well. And this is just kind of a brief overview. We are serving all of the kids. Every single kid in this district, every student is being served by the school counselor, school psychologist, school social work, in addition to a clinical counselor and community support. So they all have that ability to be served by each. And so this is just kind of a level of support tiers. It is based on the MTSS model, which is a tier 3, 1, 2, and 3 model. This is a level of support. You do see that it is a level of support 1 through 5. It's still broken down in the categories that are explained to the schools that is based on the MTSS model. And so that is what we have.
Thank you very much. Any questions, board members? Ms. Huddle?
I'm curious, like, can you talk a little bit about what are the most pressing needs that you see? And, you know, sometimes people will say, and I don't think they mean this to sound cold, but they'll say, you know, this isn't education. This isn't reading, writing, and arithmetic, but it affects education. So could you maybe talk about some examples, and also not only the impact on the child in a social and emotional, but how it affects their academics as well?
Absolutely. You know, when you find situations in which there may be a traumatic event that has happened, the pandemic could be very traumatic for kids as well as other things going on in the community or going on within their household. Depression, anxiety, mental illness, and mental health, it is across all boards everywhere. And so being able to attend to those needs, we know that 1 in 5 children have chronic mental health concerns. That actually, since the pandemic, has increased, and we're looking at a 1 to 3. And so anxiety, depression, of course, attention deficit hyperactivity disorder, that can also be, you know, more of a symptom for trauma as well. And so being able to attend to that child's mental health needs helps them not only be physically present in class, but mentally and emotionally present in class and ready to learn.
Thank you. You have one.
I was over at one of our middle schools. I'm trying to visit every school in the district before the year's out like we're supposed to. COVID's kind of gotten in the way of that, but we're trying. But anyway, I was over at one of the middle schools, and I'm kind of confused about the roles of everybody as, you know, as a lay person on the outside. But there was a teacher there that was, I guess, an interventionist, and she was teaching 4 children who had sort of like lost their way. I don't know any other way to put it, but anyway, she was teaching ELA, math, social studies, and one other subject at the same time. Are those people the social workers, or are those an interventionist type?
Thank you for the question, Mr. Lovelace. I'm going to yield to Ms. Miller, because what you just described actually is outside the role of a clinical counselor. It's more in line of an academic and interventionist. So perhaps she can give a bird's eye view as to what that means and how that role operates.
Yes, sir, absolutely. And assuming that is not knowing the exact location, but the way that you've described it, it does sound like our academic interventionist. And it's exactly what you said, who needs some extra support with those academics, whether that is English, science, math, social studies, organization, planning, all of those ways to get them back on track and back in that classroom and ready to learn.
These children, it was apparent to me, and I, you know, not knowing anything, but it was apparent to me that this has always been my question. And I've asked about, you know, the counselors and the psychologists and the social workers, which I strongly support every bit of that. I just wanted to know, at what point does that interventionist, you know, this was not your average bear. I mean, this was a situation where motivation or lack thereof or something, some part of the formula was missing. And she was trying her best to do that. And I just wanted to know, you know, what kind of support she gets from the counselors and the psychologists, because that to me would have, I mean, this was not your normal situation. And I know things were going on that I couldn't contemplate, you know, so. And I just wanted to know, how do you get involved with that situation?
Well, Mr. Lovelace, if I could speak to that to answer that question. I think when we talked earlier about those mental health wellness teams, we all work together. I say that we're kind of like cousins to each other, but we all have different unique roles. So, you know, the school social worker is going to be that bridge between school and home and community, so they're going to be the ones that are going to work with that family individually to kind of figure and alleviate those barriers to what's going on in that home environment. Our school psychs are going to work with individually with that student. They do work with families too, but they're going to work a lot more with the individual student. And our school counselors, you know, they're doing a lot of character ed. They're working in those classrooms, working with the whole classrooms, working with those students. Yes, we do work with students' families uniquely, but we all definitely have a unique role in our school clinical team. They're going to be working with our students and families, but working deep on those emotional issues that's preventing the child from being successful in that classroom. So just like you have a math teacher, an English teacher, and they all are teachers, they all have unique roles. And it's the same thing with this mental health wellness team. And even our behavioral specialists, you know, they have a unique role too to make sure that our whole child is being successful academically, because if things are going on in the home or with their behaviors, then they can't learn. So that's kind of what we want to do. We want to alleviate any barriers that's going on within that student and within that family to kind of figure out how do we problem solve that. And there's not a one size fits all. Some students are going to need 3 of these interventions and some are going to need all 5. So it really just depends on what's going on in that home and what's going on with that student to kind of really figure out and to dissect and roll back the onion to figure out what do we need to do and what does that family and that student need to be able to be successful.
So those are just like one-on-one sessions, and they wouldn't be with four children altogether?
Correct.
Okay.
Like our clinical counselors, they're going to do one-on-one, exactly right, Mr. Lovelace.
Okay, thank you.
Thank you. Ms. Gardner?
So this might be a detail you haven't worked out, or maybe it is, but are you planning on starting the intervention? I had an experience myself where a teacher found something with my child, and I was notified. Well, it went through the counselor, and then I was notified, and then we took the proper steps we needed to take care of the issue. Is that going to be still the first level before the clinical?
Correct. We definitely want to make sure that our school counselor, because we want to make sure they know what's going on within the students that they serve, absolutely. So we want to make sure that we go the lowest and then kind of build up to what the family needs, exactly.
So maybe the clinical counselor wouldn't step in unless the family said, hey, we can't take care of this for whatever
Or they
reason.
might want that. Like some families want to be served at the school. They want that, where other families want the privacy and they want outside therapy. So it's definitely a different situation per family, and we want to make sure that we ask the family what services they want. They're not mandated.
Right, but it would still be a recommendation for the parent to go to, say, their pediatrician to make sure that those steps are taken so that there's more community, like I guess that's the words on that pyramid, community involvement.
Absolutely.
Okay, thank you.
If I can offer one other thing, and I think it's implied, but if nothing else, I feel better if I just simply say it. And that is that the role of the clinical counselor is not to replace any of the roles that we currently have. School social worker, psychologist, school counselor, interventionist, behavioral and/or academic. It is not to replace any of those roles. District 5 is unique in that we have the opportunity through the use of these extra funds to have an additional layer of support and intervention called clinical counselors. And I think that's the benefit that we have here. So it is over and beyond, in addition to what we currently have in place, that I think is going to benefit our students and our families over the course of time. So we really look forward to the opportunity of moving forward and having those one-on-one conversations, one-on-one discussions, one-on-one interventions with these students. Again, that would be over and beyond, not to replace anything that's currently in place in any of our schools.
Any other questions? Ms. Huddle?
I'm just curious, just because of some bad things that have happened in the past, if you guys or any of these other people become aware that a student is potentially a danger to themselves or others, can you report that?
We're mandated. We're mandated reporters. To hurt, if they would hurt themselves or others, absolutely, Ms. Huddle. Mandated reporters.
And Ms. Huddle, even teachers within the room that's not a mental health worker, if we even suspect something, we are bound to do that, or we're liable. So it has to get checked out. That's a good question for parents to know. Any other questions? That was great, ladies. We know the need for mental health, and we hope to be able to find even more resources for it.
Well, and thank you so much again for your support. Thank you so much for Dr. Harris and Dr. Ross. Thank you so much for the school board for recognizing the need for mental health support. So thank you very much.
You're quite welcome.
Thank you.
Dr. Ross, yeah.
Thank you, Dr. Harris, for bringing this forward, and to Ms. Felkel for her hard work. I don't think our social workers ever get a time off, because even when we're on vacation or we're on holiday, they're in the communities working with families who may not have access to just sustainable housing or food and all of those insecurities. But I would offer this, and not to delay our meeting anymore, but I think it's a great point our lead clinical counselor, Beth Hook, came to me and she said, I want you to watch a documentary called Paper Tigers. If you ever get a chance to watch that documentary. And it's to the point that you made, Ms. Huddle, how does this affect academics? And the notion, just very simply, is if you hear a tiger roar, or you see a tiger, it will elevate your levels. You will get nervous. The cortisol in your blood will rise. After the threat is gone, about 8 minutes later, it returns to a normal level. But what if that threat kept coming? You would never have an opportunity to return your levels to norm, to calm. And some of our students live in constant threat, meaning they can never get their levels to calm. And so they can't learn, they can't focus, they struggle with self-regulation. They can't distinguish between a real tiger and a paper tiger. So everything becomes a threat. And we see that manifest in behavior. And so and I just wanted to thank you publicly, Ms. Hook, for bringing that awareness to understand the need for someone that can return a child down to a level where they can be able to self-regulate. So with that, it moves us to another part of our mission, and that's providing challenging curriculum and keeping the focus on academic growth and development. So I'm going to ask our Chief of Academics and Administration, Ms. Miller, to come forward and talk about the things that we're doing specifically with academics and literacy to provide that challenging curriculum with academic growth and development. So, Ms. Miller?
Thank you, Dr. Ross. We're excited to bring to you tonight some more information on our magnet programs. We thought it was a great idea to give you a little more detail about these magnet schools that were selected for the Distinction and Excellence Awards, and talk to you a little bit about the curriculum that they provide for our students. And then Ms. Sarah Wheeler, our Director of Magnet Programs, is going to come and share that with us. And then following Ms. Wheeler, Ms. McCaskill, our Director of Elementary Education, is going to give us a report on our literacy with our youngest readers in District 5. So I'll turn it over now to Ms. Wheeler.
Thank you. Thank you. I have to put my little cheat sheet down there. Okay, first of all, I am so excited that I get to come and brag twice again. And I am so proud that in School District 5, we have grown our magnet programs to 15 programs located at 11 different sites. And I just wanted you all to understand the competition involved with these recognitions they received. There was over 480 applications that came in from across the country. And our schools, of course, this is what makes me really proud. It's been a busy year, and I understand and I give them grace, but every one of our magnet schools that chose to submit an application were recognized. So that goes to show you the strength of our magnet programs. But I want you to understand what they're being judged on. Magnet Schools of Merit, those awards recognize member schools and programs that demonstrate an exemplary commitment to academic standards, curriculum innovation, specialized teaching staff, and parent and community relations. So it's more, and it goes outside of just a traditional school and focuses on all of these aspects. Hence, excellence, innovation, leadership, and community, which is a very important component. Also, our magnet schools of excellence and distinction, the difference in that is just a minor difference in points. And excellence is the highest scoring, and of course we had 2 there, and actually there's 3 programs because we had H.E. Corley that houses our leadership magnet program, and then also our new Montessori program, which is very well received and very popular within the district already. And then we have, of course, Spring Hill High School Career Pathways Magnet, and that's where I needed my cheat sheet because, and of course, my phone goes black on me. They're 5 different academies, and they're called the 5 E's. So within those academies, we offer engineering, entrepreneurial, environmental, entertainment, and exercise science. So that's an amazing offering coming from Spring Hill High School. And of course, we have Dutch Fork High School STEM program, which is a school within a school. And it has been around for a long time, and it is really an excellent honors magnet. Then we also have Irmo High School, International School for the Arts, which is a whole school magnet that has that beautiful facility that can focus on performances, video, backstage, all of those wonderful things. But within that program, we also have the International Baccalaureate Diploma Program, as well as the career-related program. And both of those are internationally renowned. And any university, college, and educational community know the IB program. And then, of course, Leapart Elementary is our STEAM magnet, and Nursery Road Elementary is our arts magnet. And I was fortunate today to host some visitors from Georgetown County that are looking about embarking on magnets. And I had the opportunity to take them to Dutch Fork Elementary School, Environmental Sciences, and then over to Nursery Road. And I was wowed myself. I thought, whew, I'm impressed. I was so amazed, and these folks were in awe, taking pictures, taking notes. So again, another proud mama. Now, we also have nationally certified magnet schools. So when they write for these awards, that's more or less a snapshot of what's taking place. But there's a year-long process to become a certified magnet school. It's more like a self-study, and they're pillars and indicators. And so we have had 4 of our magnet schools, and you have to be a magnet school for 3 consecutive years before you can even apply for this aspect. So we have 4 certified magnet schools, and those are Spring Hill Career Pathways Magnet, Irmo High School International School for the Art, Irmo Middle International Academic Magnet, and Dutch Fork Elementary Academy of Environmental Sciences. So as you can tell, we offer a wide variety of choices in our magnet programs. Magnet Schools of America also houses a poster contest where we participate in every year, and I'm proud to say we have had finalists every year. And you'll notice it shows up better on the smaller screen. You can see it, and I brought a picture. This is our Irmo Middle School entry this year that is a finalist. All of these schools of excellence, distinction, poster representatives will be recognized at the national conference in April this year. So thank you for letting me brag on my children. Any questions?
Thank you. Any questions on the program? You did such a great job. Nobody's got a question.
Oh, thank you.
You're awesome.
And I want to say thank you, Madam Chairwoman, Dr. Ross, and esteemed board members. I didn't introduce that to begin with. Thank you.
You're welcome. We appreciate you.
Good evening.
Good evening.
So I'm going to tie back into when we were talking about our clinical counselors, because really what this ties into is the whole MTSS model. Dr. Ross's umbrella of the whole child, that's what MTSS is. And Act 213 is where that comes in. So with Act 213, we are required by law to do a screener of all of our kindergarten and first grade students. And the state gives us a list of about 8 or 10, I don't know exactly how many are on the list, that we can choose from. And we've chosen FAST. So that's the screener that we use for kindergarten and first grade. So we're going to look at a little bit of data tonight as to where our students were in the winter of 2020 to where they are winter of 2021. So we can look at where we are and where we've come. Yes, we can brag on this just a little bit, so it's not all doom and gloom from all the data across this. So let's look at, first of all, kindergarten, and you'll see there's a little tick mark in between the 20 and the 2021. And you'll see on the far left side, the low risk goes higher than the high risk going lower to the far right. So that's really what you want to see. You want your low risk to grow and your high risk to shrink. And so that's what you'll see on that chart from 2020 to 2021. And then if you look at it a little differently on the next slide, if If you look at the 50th percentile, that's the line going straight across. In 2020, you'll see that 100% of our students are below the 50th percentile. Green is still good, so there's a little green below the 50th percentile, and that's still a positive, but you'll see that that has increased by 19% above that 50th percentile for 2021. So that's a great amount of growth there. And again, the benchmark, that's just looking at whether the amount of students that are at benchmark, because whenever we look at benchmark, we talk about whether they're at risk, some risk, high risk. And so you'll see that, again, the amount that are above the benchmark line are growing, which is a positive for us in kindergarten. So then let's go to first grade. Same kind of data. You will see that our low risk bar is growing. High risk is about the same, so that doesn't really change a lot there. It's pretty maintained. But you'll see that the some risk actually does grow just a bit for first grade for 2021. And then again, to look at this chart, which is just an easy graph for our eyes to look at, you'll see that in first grade, it's maintaining for the most part from 20 to 2021. Okay? And then we want to talk a little bit about tips for parents, because data is one thing, but then we talk about what can we do. I know last time you were asking about, what can we help parents with? How can we help parents? So one thing really is parents are reading to children. I know that's what I said last time I was here, like reading for 20 minutes is a huge help for parents to do. But if you'll think about asking those who, what, when, where, and why questions whenever you're reading, that really will help that comprehension piece for students and just help them to begin to look for those answers whenever you're reading or when they're reading them to themselves. Also looking for high frequency words, and I know that this is posted, so parents will have this link. This link actually links you to high frequency word list based on your child's reading level. And on each of our kindergarten, first, and second grade report cards, your child's reading level is there. So you get like whether you're on a level I or you're on a level J. And so there's a list of words that are high frequency words by those levels on this particular document. And then it's good just to have children say, do you see the word I in the book? Where do you find it? And they can point those out. Do you see and? Do you see thee? Do you see he? Do you see she? Just asking them to find those words within text. And then I'm excited to talk about a literacy night that we're going to do for the district. The state has gotten a grant to provide engagement coaches by each region. And so last week, I believe, I met with Sharonda Johnson, who is our engagement coach for our region. And we talked about some ways that we could partner. And she talked about, that she likes to do literacy nights and she'll do activities with parents. Then I met with Davita Price and Jennifer Felkel this morning. We were talking about how we could tie in our Ready by 5 initiative and bring those on board and all of that. And so we will have a literacy night for all preschool through first grade parents on May the 2nd. It's going to be really from 5:30 to 6:30. That time shifted this morning just a little bit. So the flyer, when it comes out, will say 5:30 to 6:30. And we'll be giving away books for kids and really teaching parents how just to have some nice, fun reading time. And that'll be just before the summer break, so hopefully that'll be helpful for families as well. So that is all for tonight. Dr. Ross, I'll turn it back over to you unless there's any questions.
Any questions? Oh, from anyone? See, you did get one, Ms. Hutton.
I was just curious, any reason that you think that the kindergarten scores got better?
I do think this is actually our second year of using FAST. So it was a new screener the first year. So the second year, of course, our teachers understand the assessment a lot more. We understand the assessment a lot better than we did. I also think we're in person a lot more. So to teach students the alphabetic principles and letter naming and sounds, to be in person makes a huge difference. So I think that's a big piece of it.
And seeing their face.
Yes.
make the
And
letters.
being able to see your, and see your mouth.
It
You
really
know,
is.
that's a big piece of that
Yes.
early learning and that
Yes.
early learning to read is to be able to see you forming those sounds. So that's pretty big.
Any other questions? Great. Thank you for all the good work.
Thank you.
We appreciate you.
We are very fortunate to have Ms. McCaskill and her knowledge working with our elementary school programs and bringing this information and connecting with early childhood because we know that 80% of brain development occurs in that first 3 years, and so to be able to make those connections, use FastBridge to identify that, I think one of the toughest positions we have is kindergarten, just because of the spread of knowledge that could exist from children who come in knowing how to read to children who can't identify the alphabets, and all that comes in one classroom. So thank you so much for this report and the literacy night. I'm looking forward to that at Irmo Elementary School. We will return to providing an equitable learning environment, but at this time, I want to, a part of that is our education funding reform. And so I'm going to ask our Chief Financial Officer, Ms. Marty Rawls, to come forward. We have a guest that we would like to bring, Ms. Debbie Elmore, to talk about some new legislation that may impact District 5 and schools in our state.
Yes, sir, Dr. Ross, Madam Chair, members of the board. We are so fortunate to have Debbie Elmore with us tonight. She is the Director of Governmental Relations with South Carolina School Boards Association. I was very fortunate that I got to hear a lot of this presentation when I was at SCASBO last week, but she has lots of information on current legislation before the House and the Senate that she wants to share.
Thank you. Ms. Elmore, we do welcome you.
Well, thank you,
Thank
Madam
you so
Chair. And members of the Lexington-Richland 5 Board, thank you so much for inviting me. As I approach these legislative updates, I often just approach it from the standpoint of what's happening at the State House, all the bills that are coming in, trying to evaluate how it's going to impact local districts, and knowing each district is different. You know, you have all different kinds, and so I approach it. But it was great being here and hearing the presentations and seeing the board spotlight and the wonderful work that you all are doing in this district. And it puts some perspective for me in that, you know, they can, up there at that State House, they can just legislate all day long. But you know what? It's good to know that there are doors that open every day in schools across South Carolina and in this district, and with teachers who love children and want to do the right things, and with administrators who love children and want to do the right thing, and with school board members who love children and want to do the right thing. So I appreciate that. I need to start going to more school board meetings. That's what I think I need to start doing. But I do appreciate it. And this PowerPoint is really long, and I was not planning on, you know, going into a whole lot of detail with this because I know your time is limited. But I did, I talked with Mr. Lovelace earlier, well, last couple of weeks actually, about this education funding change that has occurred in the House version of the budget, which if you saw me on the phone, I apologize, the House is still in session. They came in at 1. They were speeding through the budget, and then all of a sudden around 5 o'clock, started seeing amendments start coming. And now we've got 3 pages full of amendments and debates going on. So what they thought was going to be a quick night is now going to probably be a long, long night. And I don't know what they're going to do, if they're going to adjourn or if they're going to give second reading. So, sorry about that. But I want to get back to the funding formula to talk about that, because that's going to have huge implications. You can throw out everything you thought you knew about education funding in South Carolina because they have completely revamped it. And unfortunately, or fortunately, I guess depending on where you are, in South Carolina, we can legislate by what they call budget proviso. So even though we have bills that are filed and they go to subcommittee and have hearings and it's vetted, the public gets to weigh in, in the budget, they can actually write what they call budget provisos that direct funding, it directs those funding lines, and put policy, a lot of policy issues. And so they have completely rewritten what was once called the Education Finance Act, which, by the way, is still law. But what they've done in proviso is they can change how it works. And so they've completely drastically changed it to now create a system where we are funded, and I know Marty's going to talk more about the actual how, my question of how this impacts local districts. She's going to talk about how the funding for this district is going to really be impacted because you're one of the 5 districts in the state that actually are being held harmless. If you followed, which means actually, if you follow the formula, the way that they have allocated, this district would receive less. It would receive less than you've received. It is a complete shift of the pot, if you will. They allocated $229 million, but there's a lot of caveats in there. It's not just to K-12 traditional schools. They've added the charter schools in that. They've added the state special schools so that now it's all in one pot. You can't see, which, it makes sense probably from an accounting standpoint, but when you follow the funding, it's different. So, and the way that they allocate it back out, it just basically puts it all in one pot. They reshift how the money goes, and a lot of that money will go, most of the money probably go to your lower tax-based districts than they are the higher tax-based districts. If you are a district that pays above or at that state teacher minimum salary, if you have a lot of high poverty students, if you don't, it's all those factors are involved in that. But let me move this over here. I just kind of wanted to, I'm going to skip this one, talk about this real quick, but the plan, in addition to funding, in addition to allocating the funds to you in a different way, there's also some new expenses in that bill. It increases the minimum state teacher salary schedule by $4,000. That's probably the highest raise in a long time, a one-time raise in a long time for teachers. However, the operative word here is it increases the state's minimum teacher salary schedule. A lot of districts pay above that. There are probably, the last time I counted, there are probably 10 school districts that pay exactly on the state teacher minimum salary schedule because they're your lower tax-based districts. They don't have the tax base to generate enough funds to be able to pay above it. So they pay what the state requires. If you're a district that pays at or above, like Greenville, above the state teacher minimum salary schedule, and it's based on your degrees, your years of service, right? And so there's a cell, they call those cells. And depending on those cells, those each are going to be increased by $4,000. So I was talking to Dr. Ross earlier, in this district, you're about, what, $200 under the 40,000. So basically, it raises the first-year bachelor's degree teacher to $40,000. You're right at 38 something. Means you're going to have to increase it to 40. I'm saying that only to make sure that, especially the public, that this, when it came out, it said all teachers are going to get a $4,000 raise. Not the case. It said they were going to raise the teacher salaries on the state minimum teacher salary schedule. And so again, if you're paying above or you're paying right under it, you just have to meet it. You have to meet that schedule. The problem is there is that perception that teachers believe they're getting the $4,000 raise, and that is not the case. Not the case in all districts. And the ones that are paying on the salary scale, yes, they'll see an increase in $4,000. Now, the problem is this. The money that they're getting under this new funding formula, in a lot of cases, won't cover the cost of that because they didn't fund the increase. They just put more money in, I guess if you want to call it the old EFA, even though it's not based on the old EFA, you're getting more money in some cases, but when you look at the cost of providing that $4,000 increase, it is a lot less. The other huge cost that's being mandated in this budget is you're going from a 0.08 employer, that's the district, not employees, share of a health premium increase. It's going to 18% in 1 year, 0.8 to 18%. That's huge. That's huge. I've talked to a lot of people that have been in state government for years, and they don't recall that happening. Now, when they raised the employer share of the retirement, the pension fund, it raised it up to, I think it eventually gets to 20% or 18%. It did so by increasing it 1% every year. So you could, and for the most part, the state has been funding that up until recently, but they're funding that. Again, this 4,000 teacher pay increase is not funded. There's no line item like there's been to fund this increase. That's going to be on you, and you're going to hear from Marty where it's going to put you all. It's going to give you some, yeah. It's going to be tough. It's going to be tough, and especially there's other districts that are in the same boat, like Fort Mill. Huge cut, and they're a growing district. They are a fast-growing district. Doesn't take into account anything about your growth. It doesn't take into account anything about your wealth other than how it's distributed. It's it's supposed to be a simpler way of understanding education funding. I think Marty's going to walk. Are you going to actually walk them through that formula? So I didn't want to duplicate that. But basically, this funding formula is based on a concept that we're going to pay you at a ratio of one teacher for every 11.6 students. But it's just a target. It's a theoretical thing. The other issue with that is that who is considered a teacher is not necessarily a classroom teacher. It includes counselors. They don't, yes, counselors teach, and they work with children, but they're not in a traditional sense a teacher in a classroom. It includes a lot of certified people that aren't. So that's all it's based on. It's trying to reach a target of a teacher ratio of 1 to 11.6. They come up with a cost statewide, and then they take that cost, determine what's needed to get to that, and then they allocate those dollars to each district based on your weighted pupil units, based on the number of students you have. But again, it is tied to determine the cost of the one. Let me just go back. To determine the cost of 1 to 11, they do come up with an average teacher cost for the fringe, which is based about $69,000. I think it's a teacher who has 11 years of experience and a master's degree. So it's about $69,000. So that is the only teacher cost pay that is included in this formula. But again, it's not in reality what your actual costs are. Does that make sense? It's just this, average cost to get to that theoretical student-teacher ratio, and then whatever that is, the funding then is allocated to districts based on your weighted people, which has nothing to do with your actual costs. And therein lies the problem. That's what's going to be problematic. The other problem that's going to come into play is next year, the year after that. What triggers an increase in funding? What is it? Is it you raise teacher pay? Again, there's no correlation of actual costs versus the changing of that formula. Is it that you get more free and reduced lunch children or whatever those weightings are? It's not very clear. Unlike in the Education Finance Act, there is a clear formula, and there's an inflation factor. There's an annual inflation factor, which determines, you hear us say you're not fully funding K-12. It's based on that concept because every year they release the figure of what that should be. And it's always under that. So there is no clear indication of how that actually works going forward, because that's problematic.
Debbie, does
Yes,
it play with the normal 2% increase? Is that messed with their
the step
new idea? Yeah, the step increase.
There's no language in there to say that you're exempt, so you will have to pay that step.
Gotcha.
You're going to have to pay that step.
Gotcha.
you will have to pay the step, and that's costly. Because if you think about a school district's budget, 90% of a budget is based on personnel. So anytime you talk about salaries or anything, that's a huge portion of a district's budget. I just was asked to kind of just quickly go over some of the major bills, and if you want to stop me, please feel free to stop. So just some of the major bills that are moving pretty quickly. There's actually way more bills than this that we're following. But right now we're following 2 education scholarship account bills in the House. There's one in the House, and then there's one in the Senate. Basically what this would do would be to establish education scholarship accounts in which public funding would be put into them for parents to be able to send their child to either a private school or a public school, and a public school in another district, because it would have to involve tuition or transportation. You could use it for that as well in terms of the Senate budget. We're also following public school enrollment. Another one that will have budgeting impacts on you all is the unencumbered teacher breaks. There's a mandate in the Senate bill that's now in the House that would require you to give every elementary teacher a 30-minute unencumbered break. That may or may not have budget implications depending on where you're at. Some districts are already doing that. I don't think there's a whole lot of them, but there are some. Hiring of non-certified teachers. And there's also a requirement for a financial literacy thing. So in the House and the Senate on the parent, I'm just not going to go through all these, but basically in the House version, it's very pared down. It's very simple. It basically says we're going to have a scholarship account. We're going to award $5,000 for every child, put $5,000 into account, and that money has to be spent on the cost to attend a private school or a public school, whichever is less. It funds the program at $75 million, so it's 3 years, it's $25 million each year. It's a pilot, and it's funded through the state general fund, the contingency fund, which is what we would prefer, unlike the Senate bill, which actually takes money out of the public schools. In the Senate side, and also, let me just say, that bill sailed through Ways and Means Committee on the House side, and it's on the House floor, and it's going to be supposed to be debated when they come back. Next week, they're taking off, but then when they come back, they're supposed to take that bill up. And interestingly, in the House budget, they did put a line item of $75 million in the contingency, so they funded in there. On the Senate side, and what did I do? I'm sorry, what did I do? I hit something here. Is that wrong? That's what I do. You know what I did? I didn't mean to do that. Hit that. Okay. On the, oh well, I apologize. It's all right. On in the Senate side, it's different in that they're looking at, it's been amended, it's been in subcommittee since early January. They've amended it several times. The eligible students that would be able to participate, they're kind of the same in the House and in the Senate. You had to be previously enrolled in a public school. You can be a sibling, you have to be Medicaid eligible. And in the House, they have it from kindergarten through the 5th grade. In the Senate bill, it's K-12. You had, again, Medicaid eligible. You have to have been enrolled in a public school. Now, they changed it in the last 3 years because they know that some children during COVID moved to a private school, but you had to have attended or been a student enrolled in a public school. They did amend it. They did amend it just recently to remove the unsatisfactory below average school and just put any student who's failing. So it could be a student who's failing in a high-performing school or a student who's failing in a low-performing school. So that's the other difference they had. The funding for this program works like this. If I am in your district, the state funding that you get for me all the state funding that you get, and all the state funding that you get, you come up with an average per pupil, and it follows me to wherever I'm going. I've been advocating that if you want to do that, just take the funding that is allocated on a per pupil, because other state funds that we get go to pay for expenses that you mandate, like school resource officers, reading specialists, interventionists. Those are dollar for dollar that come. That's not based on how many children you have. That's based on an expense. And so if you want to do that, you know, take those dollars that only are allocated based on, because I'm there. Because those are the same dollars you're going to lose if I move to another district, right? If I move out of state, you're still going to get those dollars for SRO, for your reading specialist. They don't go because I leave. Let's see. The other big component of that is, the accountability. In the House, the private schools can give either a national achievement test or a state standardized test. In the Senate, it was a requirement that participating students take the state's end-of-course test or standardized test. However, this past Thursday, it got amended to be more like the House. Now, the interesting thing is Senator Massey, who is from Edgefield County, he actually supported that, and he strongly believes in that, and he basically said, I've got a problem with that. I want to be able to compare apples to apples, and if we're going to give this money to students to go to a private school or another public school, that they need to take the same tests that the kids in the public schools take so that you can compare. So that'll be interesting to see, you know, once it gets to the Senate floor. And it's on the way to the Senate floor now, so they'll debate that, I think, in 2 weeks. I think that's going to be in 2 weeks. Because the bill in the Senate says you can, and in the House, says you can take it to a public or private, they fast-tracked this bill. It's called an open enrollment bill, and it applies to public school districts. And it basically, right now, the way the bill stands, are meeting on Wednesday on this bill again. The way that it stands now is you already have this in your district. You have an open enrollment choice, I believe students can yes, I think you do, where you can, it's going to require districts provide choices to parents in every district. Parents ought to be able to choose which schools they want to attend. Now, there's a process for that, lottery, or you still have the right to have capacity. If you don't have the capacity, you don't have to create a program that's not there. I mean, those kinds of things. And then if you have magnet programs, it also, you know, we also talked about, well, magnet programs, they're also looking at other things than just, you know, a lottery. They're looking at achievement and things like that. So it still provides for that. In terms of a student coming from one district to another, it doesn't make a lot of changes to that. I mean, it just basically says, you know, they would have to apply through the district's school choice portal. So, you know, it still allows for that. The other thing that, you know, I think is a good thing actually is they also eliminated this old law that you may have it. Now, grandfathers kids in. The old law that says you can have $300 assessed value in your child's name in a school district and attend that district. I don't know if you are aware of that. It's an old law. They are saying no to that, but they're grandfathering kids that do have it. Because honestly, I mean, in Charleston County, parents are buying boat docks. In other counties, are buying grave sites. That's real properties in the child's name. You know, I mean, so it's just kind of crazy. It's just really crazy. So they're going to do away with that, but they're still right now. There was, I think, the news reported that you could go to any school you wanted, even into another district, and there's just the language is not there in that bill to say that. That's all I can say about it. All right, I'm moving along. All right, this is an implication, again, that 30 minutes unencumbered break. It's K-5, plus it's any teacher responsible for instructing a student who is removed from the general education for at least 20%. Those really are your special ed teachers. So principals are going to have to provide that sometime during the day. And according to fiscal impact on that bill, districts have reported it could cost anywhere from $0 to 19 million, depending on how big you are, because they say they're going to need to hire people to be able to oversee the children. I think that is it. Now, this bill here has passed the Senate and is currently in the House. And speaking of that, the operative date here is April 7th. So if a bill has not passed any chamber, it's gone. It's gone. It'll have to be refiled next year. So it is in the House Education Committee. We'll see what happens with that. Non-certified teachers, we fully support this. It gives some flexibility for school districts. It's not the solution to the teacher crisis, let's just say. But in the House version, there's different versions. In the House, we like the House version better. It gives districts more flexibility. You can hire up to 25% non-certified teachers in schools. If a certified teacher is not available, have to undergo the background checks. After 2 years, a non-certified teacher has to be enrolled in a certification program. And, there's all those registration requirements. In the Senate, the difference is it's a pilot program. It only allows for 10% of hiring for each school, and it's only in certain schools. It has to be in a school rated as excellent, below average, or unsatisfactory. So if you're a good school or you're an average school, you don't get that. So don't ask me about that. I don't understand the logic. That's why we prefer the House. It's just a little more flexible. And then, of course, both have the need to possess a bachelor's degree, 5 years relevant work experience in the subject that they are teaching. The financial literacy for graduation, this is one of those that I don't disagree with the need for it. I mean, it's just one of those things. It's just, I look at these and I'm like, it's just one of those that says you're going to do this kind of bill. So this is being pushed heavily by bankers, which I understand, we understand. But in the Senate version, it basically says that high school students have to complete a half-credit course in personal finance for graduation, and it's in place of economics. I was, because we were thinking, please don't add another graduation requirement. Well, in the House, they added it. They're going to have to complete economics, and you're going to have to complete personal finance. And so instead of adding it, basically they're saying we're reducing your electives from 7 to 6.5. They're both the same as it comes to the concept of that need to be taught in that. SD is just, charged with coming up with the standards, how they're going to monitor it. But there's a fiscal impact to that because you're going to have to develop standards. You're going to have to, convene a standards team. It's a process for that. So that's it. These other ones, just real quick, there's 5 bills that deal with the teaching of critical race theory. That is currently in the House Education Committee. They've had 3 public hearings, and let me tell you, that last public hearing lasted for 6 hours. 6 hours. There is a bill, of course, that we are very close to. It's Senate Bill 203, the removal of school board members, and it's in conference committee. Conference committee had 1 meeting, but then they had to adjourn. Basically, what this bill is, it's different than the other one that you might have heard about a couple of. This is about removing individual board members. It's not about removing an entire board, and it basically gives the governor authority to do so under certain criteria, which are the same criteria that can be removed for county councils or any local official. So, that's fine. I mean, we ought to be on the same, whatever they have, we need to be the same, so that's fine. There's also another one, oh God, this one here. Senate Bill 923, it is on the Senate floor. It would mandate that every school provide time for certain patriotic youth societies, and I'm just going to cut to the chase. Boy Scouts, it's a heavily Boy Scout. Tennessee's passed one. There's other states that passed it. You have to allot time to give them in front of students so they can talk about their organizations. No more than 30 minutes of a day, and it's during certain times of the school year. Most of them are at the beginning, and so while we understand, there's a good purpose for this. The way that it's being implemented is somewhat problematic in that if you have kindergarten students, first grade, second grade, they're going to sit here and listen to a presentation about joining this organization, when it's really going to be their parents that are going to be the one that have to choose whether or not their child can join. So we've tried to advocate, maybe you can have something different where you could have something where you could have like parent night or something and have the students and parents come in and hear the presentation so that the parents can be there to hear that. That one, the high school, that's another one, just another one of those bills. You got to do this, got to do that. High school seniors would complete, the federal aid form before they graduate. A lot of money in our state does get left on the table from students that have not completed that form. There are some opt-outs on that, but that's probably, that's on its way to pass the House on the Senate. So the other one is the school-based community canneries, which I personally love, but when I was had to fight it a little bit because there was no funding for it. So they finally, on the floor of the House, finally amended it, which I could, breathe a sigh of relief. It finally said, yes, this is fine, but it is contingent upon funding by the state. So, because we don't want this to pass and then pass on an unfunded mandate to school districts. But there's more, and I'm out of town, so just rattling on here. Probably more than what you wanted, but I just want to make sure I covered the main ones anyways.
We appreciate you coming, and it's a lot to digest, but I think it's important that people hear it. I would like to just stress this is still up to our legislators, and as you said, nothing is final, but there's nothing wrong with us being proactive. Ms. Gardner?
I do have a question about the funding model. I've heard from a couple of different people that the hold harmless only really applies to 1 year, but I've heard out of the person's mouth who wrote the saying, no, the hold harmless would hold over year to year for school districts like us that could lose money. I heard him say that, so I'm wondering if what you've heard on the, is it just a 1 year hold harmless that we won't lose the funding immediately, it'll come in later, or that they'll hold harmless every year?
Yeah, I will say this. The money that they use to do the hold is what they call recurring dollars. Those are dollars that they get every year. However, to say that you'll continue to get that same level, remember, a proviso is good for 1 year. You can change a proviso, and they do. They'll change it because, other priorities come into play. So I'm not going to sit here and say it's guaranteed, and I don't think the lawmaker who said that could say it's going to be guaranteed. He can say that it's recurring dollars because it is recurring dollars, but whether or not it stays on that line item and is funded at that level every year, who knows? Because they have to re-up it every year. It can get changed. It's suspect to change every year. I think the critical thing at this point, and what I would advocate to you all and advocate to every school board, is you need to get to your senators who represent you and talk about how much you're getting. Just lay it out for them and say, look, we're getting this amount, but yet, whatever you want to pay your employees is going to cost us this, just to pay for that 18% increase in your health. How much does that cost? Just lay it out for them. Just show them. We're short money. You're going to be short. You're going to probably be short money. You're going to hear about that in just a second. But, Greenville did that. They laid it out, and they, from everything, if we gave every employee $4,000, because that's typically what they've been doing, because they've been able to do it because the state has funded some of this. If they give every employee, $4,000 plus the increase in the fringe, it would be $39 million in Greenville. They're getting $19 million. That's $18 million short, or whatever it was. Then they go and say, all right, if we can do the $4,000 just to classroom teachers and the fringe, it would cost, whatever, the $20 million. And then go on down. If we gave, just to pay that step, the 2%, annual increase, it's going to cost us this much, and the fringe is going to cost us this much. And they can see how short you are. And I think basically what it also will show is the pay raise isn't funded. It's not funded.
Okay.
Ms. Huddle, I'd recognize her, but you're next.
On the Senate version, sorry, on the Senate version of the voucher bill, the state funding is, I think it's around $7,000.
Mm-hmm.
And under the finance, they're shifting from 75-25 to 70-30, right?
That's right.
So does the voucher bill include the 25 or the 30 that the county's paying? So it's only the state portion? Okay.
It's only the state.
And a follow-up question to that, I've heard from at least one legislator that there's a lot of out-of-state lobbying behind that voucher. I mean, have you heard that? I mean, basically the message was, we probably ought to just give up, that it's going to happen. Is that? I mean, I'm just, a frank opinion from someone who does this for a living.
Well, I mean, I think who knows? I guess I don't, I don't know. I'm sure, well, there are national, groups that do push issues, and, this is certainly one of those issues that are pushed. And there's funding that comes, through that as well. But that's, there's other issues too that have that. I don't know. We'll just have to see. I've been dealing with vouchers for, gosh, I don't know, 12 years. Every year. We do have a tuition tax credit program in the state that is targeted to special needs children. And again, that is out of the state general fund, so it doesn't really impact, school funding. So it's the difference, that's the big difference, is now we're talking about taking money out of the schools. And again, that's fine if you're taking only those state dollars that's allocated for that child. Right. Again, there's other state funding that districts get that are not allocated because of each child. It's allocated to pay an expense. And if now we start putting a per pupil on that, then you're going to have to come up with the money to short that expense, because that expense is going to have to be paid. It's not like you can just do away with your SRO or your reading specialists or whatever.
Mr. Lovelace had a question.
Yeah.
Yes, sir.
There's several of us that are going to see our senator on Wednesday, and this is hardly my area of expertise, but from what I heard you say, and I just want to make sure, and I'm sure that Dr. Ross is over there making, notes on this too, but step increases, fringe benefits, health care cost increases, and the $40,000 minimum for new teachers, which won't affect this district, as much as it might some others. Can you add anything else to that? Because I've got to do some homework, or we do, to be able to present to him, and I'm sure Ms. Rawls is going to show us a way to do that. But we're going to lose a lot of money in this school district, and it's going to affect all those things that we heard from tonight from people, and it will affect class size if we don't do something. And so I'm going to do my best, and I just wanted to know, I'll go over it again, step increases, fringe benefits. I don't understand the health care cost increase, because this is a large group, and I cannot understand how we're going to go up 17.2%.
They've added a wellness visit. Your health plan is now going to start paying for wellness visits.
So they're increasing the benefits to the person, but not increasing the amount of money that you're going to get from.
Correct.
Is that this one? Okay, so
they're putting it on the employer.
Right. So that often happens, and in business, what you have to do is you have to weigh off, how much that cost increase that you can afford, how much you can pass on to your employee, and then how much that you're going to have to see about a different insurance company. And this one, you're locked in with an insurance company, and you can't do any of that stuff.
That's right.
So is there anything else to those issues?
Well, one thing to add is I believe that the weighted pupil unit is really affecting us, because they essentially, they adjusted a lot of them a little bit, but they took the pupils in poverty from 1 to 1.29 or 3, and they lowered the technical education.
That's right.
So that's killing us because we have a higher percentage of children in the technical ed.
Technical went from 1.29 to 1.
Right.
So we're not getting any money. We won't get any extra money for technical.
That's right.
So you get money for keeping kids in poverty, but you don't get money for trying to get them out. I mean, that's what that amounts to.
Ms. Huddle, you need to, that was very eloquently put. Ms. Rawls, do you want to take over there from, on the budget side for us? Or do you want to?
Mr. Lovelace, is also the 1% increase in retirement that is going, will be part of next year as well.
So that was always there, wasn't it?
It was always there, but it will be an increase.
And the bus drivers, that's going to go up.
Bus driver salary schedule is going up 5% plus 3%. Because they're on the state minimum.
State minimum, right.
So they're going to actually pay something like $8 when we're paying
They
a
pay
lot more than that.
So for instance, if it's $8, you would take the increase of the 5% and the 3% on the $8, and just say if we add them together just for simplicity is 64 cents, we would be required to increase our minimum salary by 64 cents.
And we were already paying like $10 more an hour than they would allow us.
We're paying $14 something an hour for a starting bus driver.
Okay, so we're paying $6 and something more coming out of our pocket. And so they're going to basically put a lot more on us, and we're not going to get any money back. That's what you're saying?
Yes.
Wow, good. Okay, so all of that is going to amount, and I know I saw your figure in the red. I guess that's what it is, but you know, I won't scoop you, so I'll let you go ahead with that.
Let me just add one more thing, and that is we still have the Senate. There's still hope. We're going to need to get some more money in the Senate to fund this,
So we're knocking on senators'
Right.
door on
Calling
Wednesday. That's
your
what we're doing.
Need to talk to senators for sure.
There was still no action in the House today that changed anything. I think everything sailed through the House today without any amendments.
That's right. Well, they're adding a few on now. No.
They're still talking.
They're still talking.
That's right, they're working. They're down there working right
Yes,
now.
ma'am.
So if all else fails, we can go to the, a conference committee, and hopefully we can load up some people on one side or the other, you know, that would think like us, you know, because they're going to affect large school districts. I mean, the school districts that are functioning well now look like that they're going to just, you know, they're going to hurt them. That's what it is aimed for. I don't understand this, but.
Any other questions? We have some.
All right, well, Ms. Elmore, we thank you so much
Thank
for
you so
bringing this
much for
information to us and giving us that state view. And so to see how, especially how the House plan would affect our district, when I asked our CFO, Marty Rawls, to come and just give us a picture on what this looks like for School District 5.
Yes, sir, Dr. Ross. Last time I spoke, I shared with you the actual calculation. It was using the 1920 numbers. That would have been at the February 28th meeting. I did not elaborate on the calculation in this one, but we certainly can look at the numbers and how they have adjusted the numbers for the most recent 45-day count information. But if we look at the funding model, these are the changes that the House Ways and Means approved. And there again, when I left the office, everything had approved, but apparently there have been maybe some amendments, so we will update this after we get that information. But the things that are outlined in the House Ways and Means version of the budget is that the starting salary, like we talked about, for a bachelor's teacher with 0 years of experience would be a minimum of $40,000. And one piece that we didn't talk about earlier tonight, there is a clause, unless it has been removed, for that you have to maintain your local support on top of that. So while our current starting salary is $39,853, would only take us $147 to get to $40,000, that $39,853 has some local portion in that, because right now the state minimum is $36,000. So if they continue with the language that's in there with that clause, we would still have to add the local support on top of the 40,000, which is going to get us at about 44,000. So just want to make sure that you realize that piece is in there. Districts are not, like you said, it's kind of two sides of it. You're not required to pay the 4,000, but you have to keep the local percentage. So it's kind of both sides of that one. My concern about this is recruitment and retention. If we give it or don't give it, how does that affect our teachers? So if our neighboring districts choose to give the 4,000 plus the local support and we don't, our teachers are going to leave to follow the money. Yeah. So, you know, I'm not saying all of them, some of them may leave to follow the money. I don't mean that negatively. So, you know, my concern obviously is recruitment and retention. How do we maintain and support our teachers here in District 5 to keep them here? We talked about the 5% increase to the state bus driver salary schedule. Again, that's the state schedule. The starting salary is 8 and some change. We would have to do a 5% and a 3% increase on that because bus drivers are considered state employees. 5% for bus drivers, 3% for state employees. A lot of districts around the state are paying as much as $17.50 an hour to start to maintain them because that's such a turnover in that field because they can get paid so much more with the CDL out working for public, other private entities, either dump truck or what other type of driving. So, you know, it's important to maintain our bus drivers. We've had a wonderful year. We did a celebration for them right after the first semester, and I want to say it was way more than 50% that had started the year with us were still with us. And it may have even been more than 75%. I can't remember the exact number, but I mean, that is so exciting that we did not have the turnover in that field that many other districts did experience. We talked a little bit about weighted pupil units. There's two pieces to this. There's the weighted pupil unit, and then there's the weighted add-on. So when you look at the top part of the schedule for weighted pupil units, that's where you're going to see your pre-career and technology student went from a 1.29 to a 1.0. The average weighting for individuals with disabilities, all disabilities are now 2.6, where they ranged from about a 1.9 to a 2.57. Those are the above the line. Those are all for weighted pupil units. When you get to the add-ons is where they remove the weighted add-on for dual credit enrollment. They reduced the weighted add-on for limited English proficiency. They did increase the weighted add-on for pupils in poverty. The overall effect of that when you're looking at the 45-day enrollment is it took our district from 2.2% of the state's weighted pupil units to 1.99% of the state's weighted pupil units. So I have on here, and I'm sorry I can't show it to you, but this current, right now as of the 45th day, there are a little over 1.2 million statewide weighted pupil units. We, under this new funding model, have 23,899.05 weighted pupil units based on the 45-day enrollment. So when you get down to the bottom of the calculation, with all of the teacher salary and all the different pieces and parts, we are looking at being funded for 1,336 teachers. My concern with the problem is in that $69,153 that master's plus 12-year teacher, they're giving you the money for the FICA and the retirement on that, but we don't get any money for the health insurance. They're continuing to say that that's on a different line, but when you look at the health insurance at an 18% increase on average, that's going to be about $1,700 per person that chooses health insurance. In our district, we have about right at 3,100 employees that choose health insurance. Now, that's a quick calculation. And we'll get to that, but like we talked about, the hold harmless, the $4.9 million would be the loss in our funding, which would be held harmless, and they're actually going to give us $550,000 more. But when we look at the cost of all these things, the health insurance is $5.3 million is what it'll cost us on 3,100 employees on an average of $1,700 increase per person. The cost of giving the $4,000 increase to all employees, it's about 1,500 that are on the teacher salary schedule. So any employee paid on the teacher salary schedule, well, including retirement and FICA, is $7.9 million. The approximate cost of the increase for the bus drivers, about $237,000. I don't know what it'll cost for unencumbered time for teachers. I don't know how many, what do we put in the place? Do we put a teacher's assistant in? Can related arts teachers help? I don't know how all that would work out. That's something that we would need to look at. How would we handle those things? We have not talked about increases in utility costs, which I would bet a lot of money is going to happen next year. We know supply costs are going up because of inflation. Contracted services costs are going to go up. So I don't know, how do you put a dollar value on that? But when you look at the 5.3 million, the right at 8 million, I honestly think that when you look at a step, you look at all the pieces, we are really going to be looking close to about $20 million. So when you look at that $20 million and we're getting $550,000. We talked about the 1% increase for employer retirement contributions. We have not talked about giving any raises to anyone that's a teacher's assistant, administrative assistant, maintenance mechanic, food service worker, and custodian, and we could not do education without any of those individuals. We have not covered the cost for many, many other things. These are just high point issues that I've pointed out. I did want to let you know that, and I'm using estimated numbers because I still don't have the population growth to calculate the meal cap, but we're looking at about 13.4 meals would be our meal cap for this current year. About a $285,000 meal value would net us about $3.8 million in additional taxes if the board chose to exercise that increase for operating millage. And rough numbers, that's going to cost $80 per $100,000 of assessed property for investment property. There are look-back mills available, but that's going to further increase property taxes. And I want to make sure I present all the information to you all so you have the full picture. Like I said, whenever you add the step for all employees, $4,000, local increase for teachers, 2% increase in utilities, health insurance increase, and retirement, it's right at $20 million. And my concern is, what's the reality of what this is going to look like? I do agree. I think our salvation has to be with the Senate. I think that we provide this information to the Senate. Dr. Ross and I have a little phrase that we have talked about, even the winners are losers. We are among every school district in this state. You saw what Greenville presented. They are one of the largest, they get the largest of the pot of money, and they can't make it work. They have over 5,000 teachers. There's not a district that was at the conference I just left that really felt like they could make this happen. So, we're not alone. But what it does lend to is larger class sizes, less individual supports, because we can't afford it. We can't afford to pay for those items. And I'll be happy to take any questions.
Well, I think you covered it well. And I think our job is to contact our senators.
Yes, ma'am.
And continue with House members. I mean, this is in the hands of the legislature.
We are still very early in the process.
Yes, it's very early, and nothing has passed yet. And I feel like that they have to listen to the voice of the people. I really do. I'm optimistic. Any other questions?
Yeah, I just wanted to ask you on that, would you go back to the slide that had the question marks on the roll, the rollback, that we could go back on the increase the...
This one?
No, it was, well, anyway, you had a question mark down there, I think, on it, that how much, that in the past years we haven't maxed out the amount of, on small businesses and so forth.
The look-back millage?
Look back.
Yes,
Look back. I keep you, I roll back in my business means something else. But anyway, look back. So, and you said that if we went back and looked at that, that would be 3.8 million?
No, sir, what we could do for this year's
Yeah, it was
mill cap is
3.8
it would be 3.8 million. You can look back 3 years.
Yeah.
So any mill caps that have not been exercised in the prior 3 years
Right.
also can be exercised at the same time.
But we don't know what that is because we don't know what the increase in our enrollment or our growth in the area is and so forth. So
That
you can't.
That 13.4 number is not an exact number, but we do have the information on the look-back mills. I believe we had about 19 mills that were basically in the pot that could be exercised still.
So what's a mill worth on the?
About $285,000.
So 300.
We have 19.86 mills that have not been exercised in the past 3 years. So if we look at that,
20 times 300 is $6 million.
about 5.6 million.
Yeah, so and therefore we'd have to burden our small businesses down, or basically the operations come from small businesses or from boat and car taxes, right?
All of those, yes, sir.
So and then we have we have Act 388. Everybody needs to understand that limits the amount that we can raise, and that's where Ms. Rawls is getting those limits on the amount of millage that you could raise. So basically, even if you did all of this, if you added the 3.8 million and the 5.8 million together, say that's $9 million, you're still going to be in the hole by $11 million a year if they pass this thing.
Yes, sir.
So $11 million, and our fund balance of, somewhere, that they require us to have for cash flow is around 20 million, right?
We would have to have 8%, or right at a little over 8%. So with a $200 million budget, we'd have to have about 16 million.
And how much when we've taken our amount that we're spending on our capital improvements, how much remaining fund balance over $16 million do we have?
We do have some remaining fund balance because our board focuses on that 15 to 18%
right.
Minimum. So we would need to review board policy to determine, if the board was willing to dip into that lower. And Debbie, I think I understood that there may be some forgiveness on that 8% going forward if school boards had to dip into their fund balance. It's been talked about maybe.
Yeah, if we can, we got to amend that proviso. We're trying to get that proviso amended.
What I'm getting at, what I'm driving at here is it wouldn't take but 2 years of this and we wouldn't have any fund balance left.
Right. And like Ms. Elmore said, talking about the hold harmless, I know when Frank Rainwater spoke on Thursday, he made the comment that the hold harmless is part of the base budget. So, it is part of it, but there again, we still do have the 1 year proviso that it could change.
Okay.
Well, for the sake of time and our public participation, I'd like to move on to the public participation, and we're going to think positive because we're going to be talking to our Senate. I'm kind of like Ms. Elmore over there. This is not done yet. Thank you so much, Ms. Rawls. We appreciate all the information. That concludes. Can I go to
We'll
number 11?
conclude, yes, ma'am.